How to quickly lower blood pressure. Contents 1. High blood pressure disease. 2. How to quickly reduce blood pressure. Non-emergency cases. Emergency cases. 3. Video on how to quickly reduce blood pressure. 4. References. High blood pressure disease. High blood pressure is a major risk factor for stroke, myocardial infarction, vascular disease, or chronic kidney disease. In fact, the number of people with high blood pressure in the United States is approximately 86 million adults. Those over the age of 20 years, and hypertension may be either primary or secondary, and primary high blood pressure represents 90 to 95%, and secondary represents 2 to 10% of the total cases afflicted with this disease, and the occurrence of the primary type is attributed due to environmental or genetic factors. The secondary type is attributed to many disorders, especially those that affect the kidneys, blood vessels, or endocrine glands. How to quickly reduce blood pressure. Blood pressure is measured in millimeters of mercury, and it can be said that the normal human pressure does not exceed 120/80. As for the pre-hypertension stage, it is represented by the value of the systolic pressure between 120 to 139 or the diastolic pressure between 80 to 89. What should be noted is that blood pressure superscript is expressed in 2 stages, so that the first stage is represented by the value of the systolic pressure between 140 to 159 or the diastolic pressure between 90 to 99, while the second stage is expressed by reaching the systolic pressure of 160 or more, or the diastolic pressure of 100 or more. Non-emergency situations. In fact, stress therapy generally includes making some changes to lifestyle, in addition to taking medications, and the following is an explanation. Changing some lifestyles, adopting a healthy lifestyle, and making some lifestyle changes, contributes to treating high blood pressure, and enhancing the effectiveness of the drugs used in treatment, and among these changes we mention the following: reduce weight, quit smoking, follow a healthy diet, and it is recommended to adhere to what is known as the DASH diet or the dietary approaches to stop hypertension, short for the DASH diet, which is represented by focusing on increasing the intake of fruits, vegetables, and low-fat dairy products, while being careful to reduce the amounts fat total and saturated fat. Reducing the amount of sodium added to the diet, so that its amount does not exceed 1,500 mg per day for patients with high blood pressure. Exercising regularly, such as brisk walking for at least half an hour a day, so that this is repeated for several days a week. Stop drinking alcohol. Treatment with drugs. The doctor may prescribe 1 or more drugs to treat high blood pressure, and the following is an indication of the most prominent treatments that may be prescribed in this case. Diuretics, which are the first line of treatment for most patients with high blood pressure. Angiotensin converting enzyme inhibitors, and they may be used as a first-line treatment in some conditions, such as those with diabetes. Angiotensin II receptor blockers, beta blockers, calcium channel blockers, alpha blockers, alpha agonists, renin inhibitors. Emergency bout include excessive blood pressure, in English, hypertensive crisis. 2 main categories. These are hypertensive emergency and hypertensive urgency. Urgent hypertension is represented by reaching a blood pressure reading of 180/110 mmHg or more without exposing the target organs to any damage. This HADF indicates that the target organs represent the heart, lung, brain, and kidneys, while emergency hypertension is represented by exceeding the systolic blood pressure reading of 190 mm Hg or the diastolic pressure of 120 mm Hg, in addition to damage to the target organs. In general, the treatment aims to reduce blood pressure by 15 to 25% in the first hour, taking care not to exceed 25% in order to avoid organ damage or other side effects. And with regard to the treatment of hypertension crisis, it is done within the hospital or intensive care unit. It is to give the patient a drug, nicardipine, intravenously, so that a dose of 5 mg/hour is started, and then the dose is increased by 2.5 mg/hour every 5 minutes until a dose of 30 mg/hour is reached, and it should be noted that the dose is adjusted according to the patient's need, after which the patient is subjected for continuous monitoring, and based on its response, the dose is gradually reduced to 3 mg/hour. It depends on the patient's tolerance, and it should be noted that when blood pressure drops to 140/85 mmHg, the patient is referred to the drug nifedipine, which is taken by mouth. Before the patient is discharged from the hospital, some adjustments may be made to the patient's treatment regimen according to his condition, and the medical staff will direct instructions to the patient, especially those related to the importance of taking medication according to the doctor's instructions, in addition to the instructions related to non-drug methods, which contribute to controlling a person's blood pressure, such as the appropriate modification of the diet, weight reduction, and smoking cessation, and the patient should commit to visiting the doctor's office periodically to ensure the stability of his condition. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new